Hello everybody. This is Tasha getting back to the real tea. I'm coming to you for my week 21 post-op VSG surgery. And a lot has gone on since I spoke with you all last. Sorry about that. Actually, I put a video out, I believe it was the Thursday after Memorial Day, which would have been week 19 for me. And that was because I had to have my gallbladder taken out. So basically, well, let's start with numbers. Okay, so week 21, and my highest weight prior to pre-op was 245, and I went into surgery at 233, and I am now down to 187. And so that's a total loss overall of 58 pounds from the beginning of my journey, January, and 46 pounds down since surgery. And so basically what had been going on with me is I was having a lot of sharp pains, and I kind of overlooked it for a little while because that's something I had been dealing with prior to me moving to Orlando when I lived in Atlanta. It had been happening for a couple of years, and my internist there did ultrasounds, and everything was fine. They did see some sludge in my gallbladder, but they didn't see any stones or anything like that, so they thought everything was fine. But I continued to have nausea when I ate, and basically just pain every now and then, like a tummy ache. So I started taking antacids, and that did seem to help for a good while. But since I've had the surgery, I've noticed a little more pain, a little more nausea when I eat, and what started happening is I would have these really sharp pains, felt like contractions, and I would have it for basically, 5-10 minutes, and then it would go away. One time it woke me out of my sleep. I started having situations where I would wake up out of my sleep choking and gagging, heartburn really bad, and it became really bad. And I called my doctor and my surgeon, and they called me back, but by the time they called me back that particular day, which was before the holiday, it basically had went away. And I said, I'm not going to worry about it. I'll just talk about it at my next visit. So I just went on like normal, and the holiday weekend, I couldn't eat. Nothing I ate tastes good. It was just nothing, and I didn't even partake in the holiday foods. I made all this food for my family, ribs and baked beans and coleslaw and string beans and all of that, and I really didn't partake in it. So I just ate tuna fish, but nonetheless, my stomach was still hurting. So basically, I got to work on Tuesday, and I was drinking my cup of coffee, and I started having the pains. And so I thought, okay, well, maybe I need to go to the restroom, because I do use Miralax almost, every day, if not every day, 5 days a week. So I'm thinking, oh, maybe I just have to go to the bathroom. So I go, and that didn't stop my pain. So basically, I found myself curled up on one of the exam tables in pain, called out to my coworker, and basically was like, look, I've been in pain for like 45 minutes. It's not going away. I don't know what to do. I need you to call my doctor, because I couldn't even do all of that. And so they started panicking. I don't know. Started panicking and calling 911 and calling my husband. And so basically, I was carried out of work on the stretcher and got to the hospital, and they did the ultrasound, and so I was full of gallstones and more sludge in my gallbladder. So basically, they were like, your gallbladder needs to come out. And also, the interesting thing about it is the hospital I had to go to is close to my house, but where I had my surgery is further south. So none of the surgeons at the hospital wanted to do it. So they called my surgeon and said, hey, one of your VSG patients is here, and her gallbladder is bad. We need to get it out. Do you want us to do it, or do you want to do it? And he was saying, I can do it, because none of them wanted to do it. They didn't want to touch me. So basically, I was discharged after being at the hospital all day long, and they basically had me go to see my doctor the next day. He did a pre-op visit and scheduled me for surgery for the next day. So that Thursday after Memorial Day, I had my gallbladder out. So since then, I have not been able to eat really still. I just don't have an appetite. I try to drink my protein. It's difficult. So I know I'm not getting the right amount of protein in right now. I am getting a lot of fluids, but I just need to figure out, it's not hard, but I just need to make more of an effort to really drink my protein, seeing as how when I try to eat, I really have no appetite, so it's really hard to make myself eat. The only thing that I seem to be okay with is like some crackers. I can eat fruit. I can eat some fruit, and that seemed to be okay. I mean, it makes me burp a lot, but I don't think that has anything to do with my gallbladder. But I'm just not eating meats and eating protein things like I should. So that's something that I'm working on building back up. My weight loss is going good. I'm very happy with it. It seems like when I did the numbers for you guys, I'm like, oh my gosh, it seemed like I should have lost more, because this is my 5th month. But everybody loses different, so I'm happy with what I'm seeing right now. Basically, I have to go this weekend and get another uniform. My pants are a medium for my scrubs, and my shirt is a large. It looks like a cape over me. So I guess I'm going to be in the smalls. Probably still need a medium shirt because I'm big busted. Those aren't going down. So I want some, but not as much. I'd like a nice C, but I don't know. I don't think that's where it's gonna end up. So we'll see. And so I think I'll need a small for my pants, which, child, I don't know if I ever wore a small scrub since I've been in the medical field, which is almost 22 years. So, but I'm excited. My regular clothes are, I'm in my 12s comfortably. I'm getting ready for vacation the middle of July, and my goal weight for vacation, where I'd like to be the middle of July, which really will signify 6 months, I'd like to be 175. So I don't have much to go, so I'm hoping I can get those 12 pounds off and get down to at least my short-term goal for my vacation. And I'm starting to try to walk again. I was down for a couple of weeks without exercise. I've probably been down a little bit more than that, but definitely for the last couple of weeks I haven't done much exercise. But everything is going well. I don't think I have much more to report. A lot of I get a lot of compliments right now. My patients I work in oncology, and so I do have some patients that they're in remission, so they may come once every 6 months, and some of them hadn't seen me since I've been on this journey, and they walk in, they're like, oh my gosh, I can hardly recognize you, look at you, you look so good. So they're noticing. My doctor that I work with he's a big fan of the sleeve. His brother had the sleeve in Pakistan. And so he is he's been a very big supporter of my journey, and he's always, making sure I feel okay, and just asks me about how things are going. And my coworkers have been really good. I tell people I had the sleeve. I don't like shout it from the rooftop or anything, but if someone is like, oh, you look really good, that knows me, and say, oh, you look really good, and you've lost a lot of weight, I'll say, I had the sleeve. And for some reason, I work in hematology oncology, and so we get a lot of patients that for some reason there's been like an influx of patients that are coming in that had the bypass, and they're having a lot of anemia problems. And so I've been able to talk with a lot of them and about their journey, and I'm kind of happy that I went with this route, because I can just imagine with my history I probably would be one of those people that's having a really big problem with their iron levels as well, because it seems like I get the issues. So I'm glad I went with the VSG, and that was one of the reasons why I chose the sleeve over the other, so the gastric bypass. So basically, I'm not having a lot of skin. I mean, I have some skin in my thigh area, but it looked like that prior to surgery. So I'm assuming just with working out and toning that it'll get better. If it doesn't, hey, I can't worry about it. And I have some skin, and that's just what it's gonna be. Because I will not be having surgery for that. I am so over surgeries, I don't know what to do. I did speak with my GYN. I know a couple of times ago that I came to you all, I was telling you about my pain with during my cycle. Sorry, guys. And the fact that now that you're sleeved, you're limited on what you can take for pain. And mine they've always been extremely painful. Like, I have fibroids, so they've always been very, very painful. I had a tubal ligation, so the scar tissue from that, it's just awful. So anyway, I talked with my GYN, and basically she's saying, well, you can have an ablation, which will stop my cycles, burning the lining of your uterus off, or I can have a hysterectomy. At first I was thinking, well, I need to go ahead and just do the ablation and see how that goes, because without the cycle, then I shouldn't have all the pain, and with personal time with my husband, if I don't have a cycle, then it should be fine. It shouldn't be any pain. And I think I'm gonna give it this month to see how it goes, but I think I might opt for the hysterectomy, because I'm thinking, yeah, that'll stop the pain from when I have my cycle, since I won't have a cycle, but the fibroid pain is still going to be there when I'm active with my husband. And so, I don't know what it is. I guess I'll have all that extra cushion, so we're able to be a little closer, and so it's just too much pain, and I can't deal with this. So I'm like, you want to lose the weight, but then it comes other things. So I guess, this is just one of those things I have to deal with. And I have one more surgery reserved, and I think I'd rather use that for a hysterectomy, not for plastics. I just, he knows what I look like. He knows how I am. He knows my heart inside. So I'm not going to worry about, if my boobs are sagging or my thigh skin is sag. I can't worry about that. That's, the weight will be off, and that's all I can be concerned with. I just don't have it in me. I have one more surgery left, unless it's like life or death. So I'm going to use that for a hysterectomy. I think I'm going to give it this month and see how things go, but I think that's what I'm going to use it for. And then other than that, we just deal with whatever the consequences are of, losing weight. But everything is good, guys, and just want to thank all of my new subscribers. As you subscribe to me, I go and subscribe to you, so we can encourage each other and share advice, share experiences with each other. So thank you to all my new subscribers. Thank you to my existing subscribers, and I just look forward to sharing with you all and hearing more from you all. And I know I've tried to do at least once a month. It's every 2 weeks or every week. It's not enough to talk about, and life gets really, really crazy because I'm this year I had my resolutions and I was just like determined to do it. So this year my resolution was to get the weight off with having the surgery, and eating healthier and working out along with it, and just maintaining a better, healthier lifestyle. I am ready to move more into the business side of healthcare, and so I am I'm going back to school with my online degree, and also working on a certification that will allow me to transition into the business side now, and also to be more involved in ministry. So those were my goals, and I'm working on all of them. So things are kind of crazy, and but I just, I try to make sure I come on at least once a month and say hey to you all and give you an update. So thank you to everybody, and I will talk with you again next month. And I'm going to try to do, I'll do some pictures from my vacation. Well, I'll try to do it before my vacation, and that way I'll do some pictures and try to do a full body shot and go from there. All right, you all, take care and be blessed.